News special edition of 2020.
The babies are just growing up. They can still get sick. And they're really important to me. I just don't want anything to happen to them.
It came back positive. Yeah, and it sucks.
From the very top.
It's bad. It's bad.
To those struggling at home.
We need one more breath.
With the day-to-day reality.
For the time being, this is the center of the universe.
Adjusting to the new normal as cities and entire countries go on lockdown. Quarantined at home and waiting for results.
I don't know when I'm going to be able to leave my house. I don't know if I've infected a lot of people.
The very latest on testing.
Bottom line, how soon can you get a test?
Literally now, as we speak, we are told there will be millions of tests over a period of between now and the next few weeks.
And if you're infected, step-by-step guidance on what to do. Our experts live in the studio answering your questions. Pandemic, what you need to know. Here's David Muir.
Good evening, and thank you for joining us for this special live 2020 Pandemic, What You Need to Know. And as we come on the air tonight, much of America shutting down. Late today, President Trump issuing new nationwide guidelines for Americans across this country in the fight against the coronavirus. The outbreak spreading across the U.S. More than 1,300 new cases in just the last 24 hours, and that's without testing fully up to speed. In total, more than 4,600 cases in 49 states, at least 82 deaths. Late today, President Trump acknowledging the coronavirus is not under control, urging Americans not to gather in groups larger than 10 and to avoid restaurants and bars. And he said the U.S. could be dealing with this right into the summer. Tonight, a major lockdown has been declared in the San Francisco area. Nearly 7 million people in several California counties have been ordered to shelter in place, to stay at home for weeks. And the stock market free fall, even after action by the Fed in a rare Sunday move, the Dow halted shortly after opening today, emergency triggers kicking in, and by day's end, dropping nearly 3,000 points, its worst point loss ever. Our chief medical editor, Dr. Jen Ashton, and a team of doctors are right here tonight taking your questions on Twitter. Use the hashtag AskABC2020, and we'll be checking in with the entire team all night. But we're going to begin tonight with the remarkable changes occurring at a rapid pace across this country, a reset of American life. I'm sure you saw it for yourself this weekend. You walk into a grocery store somewhat expecting it, but it's still a stunning sight to see. The empty shelves, millions of families worried about what's coming, trying to stock up. Parents trying to find childcare with schools closing in at least 35 states. And there's also the ongoing struggle for those who fear they have the coronavirus or have been exposed to it. Where and how do they get tested? How quickly will they get the results? Is what we're seeing in Italy and in Europe about to play out right here in the U.S.? I'll ask Dr. Anthony Fauci of the National Institutes of Health, the nation's top infectious disease expert, that very question in just a moment. But first tonight, the new guidelines from President Trump late today. Tonight, America shutting down. Late today, President Trump issuing new nationwide guidelines for the next 15 days.
We'd much rather be ahead of the curve than behind it.
The president's task force now urging everyone to avoid gatherings of 10 or more people, to avoid restaurants and bars, discretionary travel, encouraging older people and those with underlying conditions to stay home. The administration also telling people not to visit nursing homes and recommending bars and restaurants close in states with community spread. Reporters at the White House today were greeted with signs telling them to sit separate from one another. Their temperatures taken before they entered the White House briefing room. The podium cleaned right afterward.
If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus.
You're not saying it's under control, right?
I'm not referring to it, meaning the... Yeah, if you're talking about the virus, no, that's not under control for any place in the world.
And late today, the president warning that the crisis could stretch deep into the summer.
People are talking about July, August, something like that. So it could be right in that period of time where it washes through. Other people don't like that term, but where it washes through.
Tonight, with cases across the country climbing, several counties in the San Francisco Bay Area issuing a sweeping shelter-in-place order to stay home for nearly 7 million Americans. Residents told to only leave their homes for food, medicine, and exercise. And California's governor tonight urging home isolation for all adults over the age of 65.
Most important thing, again, is to protect the most vulnerable.
More than a dozen states closing bars and restaurants except for takeout and delivery. including New York, Connecticut, and New Jersey, who are also closing gyms, movie theaters, casinos, starting tonight. Across this country, at least 35 states now closing public schools, forcing more than 35 million school children to stay home.
Creates a lot of hardship for people, but it's the right choice.
And we have all seen it for ourselves across this country. The empty shelves from Omaha, Nebraska, to the long lines at Costco's from Illinois to Los Angeles.
Thousands of people are rushing to trying to get into the Costco here in this.
Lines snaking around the building before dawn. Nationwide stores running out of basic items like toilet paper and water. And tonight, this message from the Stop and Shop grocery chain announcing new early shopping hours for customers 60 and older. And despite major new action by the Fed on Sunday to cut interest rates to near zero, the Dow halted just seconds into trading today, closing down nearly 3,000 points. All of this as some of America's hospitals and healthcare workers sound the alarm, reporting spikes in incoming patients amid a shortage of critical protective gear, setting up tents outside emergency rooms. And another critical matter that remains tonight, the testing. Who can get a test, where, and how quickly will they get the results? Workers on the front line saying there may be more tests, but we need protective gear. And President Trump late today was asked about his own test he took over the weekend.
Not something I want to do every day, I can tell you that. It's, it's a little bit of good doctors in the White House, but it's a test. It's a medical test. Nothing pleasant about it.
The White House saying the president tested negative for the virus. Tonight, the president of France declaring Europe is at war with coronavirus. The UK taking wartime measures, asking companies like Ford and Rolls-Royce to manufacture vital equipment like ventilators. And British actor Idris Elba posting this message, saying he has tested positive for coronavirus.
This is serious, Now's the time to really think about social distancing, washing your hands.
He says he feels okay and is now in self-isolation with his wife, who hasn't yet been tested. And here in the U.S., an NBA player with the Utah Jazz, Donovan Mitchell, and his own message. He is isolated after testing positive for coronavirus too, and his case highlights the need for more testing.
I keep making the joke when people ask me. I said, if you were to tell me I'm about to play in a 7-game series tomorrow, I'd be ready to lace up.
That's really something. Donovan Mitchell testing positive, but saying he has no symptoms, which, of course, begs the question, how many Americans have this without even knowing, and when will the testing finally be up to speed? Are healthcare workers on the front lines ready? Do they have the protective gear they need? Are there enough ventilators in this country? I spoke with Dr. Anthony Fauci of the National Institutes of Health, the nation's top expert on infectious diseases, just before we came on the air tonight. Dr. Fauci, thank you for joining us here tonight. You have been sounding the alarm for weeks now, and we heard the president late today issue those new guidelines, no restaurants, no bars. We heard the president acknowledge coronavirus is bad, is not under control. Can you tell the American people watching tonight who have seen what's happening in Italy and elsewhere as best you can, what we're about to see here in the U.S.?
Well, what we're about to see, David, is that things are definitely going to get worse before they get better. If you look at the pattern of the outbreak as it hit different countries and different cities within countries, and I talk specifically about China, about South Korea, and most recently Italy, what happens is that you putter along with cases, a few, and then you reach a point of inflection where it takes off. And if you look back at the history of outbreaks, you get this big, big peak, and then it starts to come down if you leave the virus to its own devices without trying to interfere with it. We have the opportunity now, even though we will still continue to see an acceleration of cases, we have the opportunity to blunt that peak and essentially make it more of a mound, which would mean less sick people and less death. But that's not going to happen spontaneously.
Dr. Fauci, I have to ask you what viewers have been asking us, and they commonly ask about the tests in this country. We've heard promises from the administration of 1 million coronavirus tests, then the promise of 4 million tests. You've already called it a failing in your words, so I don't want to go over it all over again how it began, but we're now weeks into this. So bottom line tonight, if you're an American who meets the criteria on the CDC guidance, we've been saying if you have a fever of 100.4 or more to call your doctor. But bottom line, how soon can you get a test if you need one, and how soon will you get the results back?
Well, the situation has really changed dramatically, David. Again, we admit, and I have been publicly saying that a little bit ago it wasn't really adequate to meet the needs. Right now, there has been a major embracing of the private sector, which is, calling upon the forces of what America does best, private industry, and get those companies and those labs involved. And we are told in discussions with the CEOs of those labs and with the state and other government that the tests that are going out there literally now, as we speak, tomorrow, the next day, the next week, are going to take that riveting up till you get to the point where there will be millions of tests per several weeks over a period of between now and the next few weeks.
Well, Dr. Fauci,
I tend to,
you speak of the CEOs there, and we certainly hope that that's true, but we heard from healthcare workers on the ground just today who said, we have the test, but we don't have the protective gear. And we heard from workers in some of these labs who say they're also concerned that they don't have the gear that they need, the protective gear, to actually process these tests.
That's a very good point, David, and I would have gotten to that, but you're right, and I appreciate you're bringing it up. It's not just the test, it's how you can actually deliver them. And the people who are involved now in making this happen. But when you start something up, David, it doesn't go from nothing to 100% effective right away. What we're going to start seeing is that there will always be people who are not getting the test or the results exactly when they want it. But that's going to be changing rapidly over the days and weeks.
When Americans see what they have seen with these tests, they're going to be concerned about equipment, supplies, the adequate number of healthcare workers on the front line. We heard what the president told the nation's governors today, that don't wait for the federal government, for the White House on ventilators. Go get them on your own. Do we have enough ventilators in this country for what's coming?
Well, it depends on what you mean, David, by what's coming. There are about 12,700 ventilators in the Strategic National Stockpile and the ability to backfill with several thousand. I mean, if you have a situation like they have in Italy, I don't think any country or any preparation in the world will be able to be adequate to have the equipment that you need. What we're trying to do, apropos of what I just told you a few moments ago, is to blunt that response, that we be able to handle it with the equipment we have. But when you're dealing with a fluid situation like this, you're really racing against the virus, trying to get out of control as you're trying to keep it under control. The more you keep it under control, and that's where the mitigation and the containment comes in, the less you'll be in risk of running out of that vital equipment that you need.
Doctor, can you assure the American people that what they've witnessed in those images from Italy and from those hospitals won't happen here?
David, I'm always trying to be as cold and honest. I don't want to scare anybody. There's no guarantee of anything, but I can tell you we are going to try our very best with all of the resources, all of the force, all of our might to make sure that doesn't happen. But, David, it is going to require the cooperation of the American people, because the reason why we made the announcement this evening about don't go to bars, don't go to restaurants. If you're an elderly person, shelter in, stay at home, don't go out.
Yeah, it's going to take every community in this country. I wanted to ask you before you go about the reports out of France over the weekend of the hundreds in critical condition, potentially. They reported half could be under 60. What does that tell you? And perhaps more importantly, what do you know right now about who has this right now in the U.S., what the demographics are? What are you seeing in Americans right now?
Well, it's not, the number in America is still low, but we're seeing the patterns that we saw in China and that we saw in South Korea, which is that if you look at the people who get into trouble, they are overwhelmingly weighted towards individuals who are elderly and individuals who have underlying conditions that compromise their ability to fight the infection, like heart disease and lung disease. You will always see outliers of individuals who are otherwise young and well, who wind up getting into trouble, getting seriously ill, and even dying. I'm very interested in, and we want to follow up on those reports from France that say that there are several people. When I heard that, I called up some of my colleagues, some of whom I trained years ago in my own group in Italy, and I said, I'm hearing this about France. What are you seeing in Italy? And he admitted, we are seeing a few people, a minor proportion, but they certainly are there, of younger people in their 40s and 50s who are getting seriously ill. But he confirmed that the overwhelming majority of the people who get into trouble, the average age of the people who really get sick and die is 80-something years old.
But of course, we all just want to make sure that there isn't a false sense of security out there as well, which I'm sure you share that concern.
David, let me be on the record and be very, very vocal about this. We don't have a false sense of security about anything. We take everything seriously. Yes, of course, when you look at the numbers, younger people do much, much, much better. The overwhelming majority of them do well. When we start hearing reports of people who are 40s and 50s and 60s who are getting into trouble, you have to pay attention to that and find that, A, is it real? And it is real. Why is it happening when we didn't see it in other countries? So nothing is taken for granted. No false sense of security.
Dr. Fauci, thanks so much for being here tonight. We appreciate the work you're doing.
Yeah, good to be with you, David.
So let's take this over to Dr. Jen Ashton now and the medical team, who, by the way, will be taking your questions as we're on the air here tonight. But Dr. Jen, first the news that Dr. Fauci just made there. We talked to him about the headline from France that of the hundreds of patients in critical condition, there were reports that about half of them potentially could be 60 or younger. Right. And even Dr. Fauci said, I got on the phone, I wanted to know more about that.
Right. And that's why it's so important for us to test more and to release our clinical data from the United States patients. We need to know what our average age is here, how many are serious, how many are critical, what pre-existing conditions they had. We don't have that data out yet.
And you heard him acknowledge that again today, saying that it hasn't been adequate in this country. In fact, he said it's been inadequate to meet the needs of testing so far. But that's what's so important here. It's not just to tell an individual whether or not they have coronavirus, but it's what it could tell the medical community about where it is in the country and who's being hit the hardest.
100%. And we're expecting some early results possibly out of the Seattle cases and the rest of our U.S. cases any day now. But right now we haven't had that. And we're seeing already a burdening of our healthcare system. We need that information to help us make our decisions. Data drives decisions in medicine.
A lot of people at home have been asking us about the supplies on the front line, in particular ventilators, which we've heard a lot about. He talked about, in addition to the 62,000 we have in hospitals around the country, 12,700 that have been stockpiled. But he also acknowledged that if we were to have coronavirus hit the way it's hit in Italy, he said no amount of preparedness would be enough.
Right. And when you look at our critical surge capacity, David, it's based on space, staff, supplies, and systems. Ventilators don't run themselves. They need respiratory therapists and critical care nurses. We have a shortage of that type of personnel, but that is partially why we're hearing as recently as a few days ago, the American College of Surgeons saying postpone all elective surgery and procedures because those things use valuable resources like ventilators and masks, and we need those now.
That's a really important point. And just to drive this home, what we heard from President Trump late today, these new guidelines to avoid restaurants and to avoid bars. A lot of people might be asking, is this a step too far? But Dr. Fauci, and I know you would say, this is exactly what we need to do because Dr. Fauci was talking about flattening the curve again.
That's right.
So that the ventilators, the medical workers in the front lines, that our supplies can keep up. And if you can keep the number of cases lower over perhaps a longer period of time, correct, it gives our medical staff around this country a better chance.
100%. And Dr. Fauci himself said when you're trying to contain or respond to an infectious disease outbreak, you're always behind. So we need to take those aggressive steps now.
All right, covering the late news of the night, we're going to answer everyone's questions at home, so keep them coming. There's still much more ahead. On the special live edition of 2020, we're going to hear from Americans who have coronavirus tonight. So many have been wondering, what are the symptoms? How many are walking around asymptomatic? We're also going to take you inside the lab tonight, one of those private labs, to show you the equipment capable of processing 1,000 samples a day. But do workers conducting the tests, do workers then processing the samples have the protective gear they need? We'll get some answers on that. And just in from France tonight, the French president now saying we are at war. The alarming headlines about those younger than 60, we'll dig into that a little more tonight. And what does that tell us? In Italy, at least 349 deaths in just the last 24 hours alone. And this number that got our attention as well. In Italy, they have more hospital beds, more doctors per capita per person than we have here in the U.S. So again, is America ready? We're back in a moment. Next tonight, here's so many questions about testing in the U.S. News that private labs are now joining the fight. Tonight, we're going to take you inside one, but how many kits are available and how quickly will they now get this done? Here's ABC's Matt Gutman.
How have you been feeling?
My head's been hurting, but that's all. I've been pretty good besides that.
It's become an all too familiar story. 8-year-old Adele Tyson of Westchester, New York, came down with coronavirus-like symptoms last week. So her mother, Vita, called the health department hotline to get her tested.
I called 8 different numbers, and I spoke with 8 different people. And they meant well. And then they referred me back to the original number.
Vita gave up, but then she fell ill herself. And the local ER tested her on Tuesday. 6 days later, still no results.
I don't know when I'm going to be able to leave my house. I don't know if I've infected a lot of people. And I can't tell anyone anything because I don't know.
Testing numbers nationwide are still lagging. New York has conducted roughly 7,000 tests since the outbreak. North Carolina's public labs have only done about 300. However, in South Korea, where the number of cases have now flattened, over 275,000 tests have been conducted. They've even now created phone booth-type testing sites. But back home, health workers need to be in full protective gear to administer the tests. In some cases, they're proving scarce.
So the current test that's been available up to this point has been very manual or labor intensive. So that has hindered how quickly we can turn results around and the volume of tests that can be done.
But this weekend, we may have turned a corner.
The FDA approved a new test for the virus. We did this within hours after receiving the application from Roche.
Roche Molecular Solutions and another private biotech company, Thermo Fisher, received emergency FDA authorization for new tests. Breakthroughs because of the speed. Patients no longer have to wait for days for results. Now, just 3.5 hours.
What we can now expect is that we're going to provide 400,000 tests in the coming days. So that will mean that we will make available about 1.5 million tests every month.
How did Roche pull it off?
The challenge was the timeline. Could we do it in 6 to 7 weeks, as we were being asked to do?
We did something that usually takes 12 to 18 months.
So we had to reinvent how we did things.
With the potential to be a COVID-19 game changer, the Roche factory went into overdrive. With the thumbs up from the FDA around midnight on Friday, the tests rolled out over the weekend. This New Jersey shipping team loading trucks, heading out to over 30 labs across the country. And today in Chicago, Kathleen Beavis of the University of Chicago put the new test through one of its first runs this afternoon.
So they're literally dropping in as we speak. You're getting specimens as we speak.
Yes, we are.
The results?
5 positives out of 43. Yes. Again, this all goes to helping us track where the existing cases are and where we might have higher pockets of illness in the Chicago area.
Many of these experts have skin in the game. Dr. Valsamakis' husband is already suffering from heart trouble.
He's in the highest risk category group of people to die from this infection. This is personal. I want to protect him.
So many questions about testing coming into the team. So let's get back to Dr. Jen. And someone wrote, actually it was Courtney, she said, please ask Dr. Ashton, first of all, how long can one be a carrier of COVID-19 before actually showing symptoms? Do we even know the answer to that?
We don't know, David. We know the average incubation, based on a published study that just came out last week, was 5.2 days. By 11 days, 97% of people will convert to positive, but we really don't know what that range is. We still need to test more people.
And that's just a question before showing symptoms. There are still many who are asymptomatic.
Right.
We heard that from Donovan Mitchell, the NBA player for the Utah Jazz, who said he tested positive, not feeling any symptoms. And there was a question from Tim who wrote in, if asymptomatic or no symptoms, shouldn't we still be tested if we are contagious to others?
Well, the long-term answer is yes. We need to test a lot of asymptomatic people, but we're not there yet. So right now it's what's considered a tier 3 level, an asymptomatic person in the community who maybe was just exposed to a confirmed case. Right now, the real answer is self-quarantine, because the ability to test asymptomatic people just is not there yet.
Because there would be a crush of people then trying to get tested, and we already have seen what's happened in our country with the testing process so far. So again, if you have symptoms that fever of 100.4 or above, call your doctor.
In some cases, absolutely, if you have a medical condition. But remember, some people don't have a high fever with this. So again, that's why we need to test a lot more people.
And if you don't have the fever, but you have some of the other symptoms, what are they to look out for, Jen?
Body aches, extreme fatigue, severe headache, and dry cough. If you have a healthcare provider, you want to call that person. If not, as we heard, try calling the Department of Health, but it might take a while to get through.
It might take a while, so call your healthcare provider. Don't just show up, because otherwise you risk, if you don't have it, perhaps coming into contact with somebody who does.
Absolutely.
All right, a lot more to come, Jen. Thank you very much. And when we come back here tonight, what we're seeing right now in Europe, the epicenter of this global outbreak, what we can learn from what we're seeing there as well. The French president tonight saying we are at war. Italy's death toll soaring once again, at least 349 deaths in just one day. Because of the lockdown, there can be no funerals in Italy. And what we've learned tonight about a bishop who met in recent days with Pope Francis, who has now tested positive, that bishop. Dr. Jen answering your questions. Keep them coming tonight. Use the hashtag AskABC2020. We're going to turn next tonight on this Live 2020 to Europe, to Italy, because health officials in this country are studying what they're seeing there, what they're seeing in France. We heard that from Dr. Fauci earlier. In Italy, in fact, they have more doctors and more hospital beds per capita than what we have even right here in the U.S. So we'll drill down on that as well. And tonight, the Vatican now revealing a bishop who recently met with the Pope has now tested positive. Tonight, at least 349 deaths reported in just the last 24 hours in Italy alone. The images are haunting. You've seen them. France, Spain, and Germany now locking down their countries. And ABC's James Longman tonight from London.
Italy has now had nearly 28,000 cases, with more than 2,100 deaths. And as the toll surges across the continent, Europe is now the epicenter of the COVID-19 crisis.
More cases are now being reported every day than were reported in China at the highest of its epidemic.
And now Italy's health service, one of the best in the world, is overwhelmed.
Now we are starting to discharge many patients, and this is very good, but as soon as we discharge a patient, we receive another one.
New admissions seen in tents outside hospitals to stop the spread inside. Thousands now fighting for their lives and their dignity.
We are almost at the same level as an emergency ward,
says nurse Alberto Poinelli at this tent hospital in Brescia. He says the main issue is the fear in patients who test positive, having to calm them, reassure them, and give them a plan they can trust. There can be no funerals in Italy, only names in the paper. Pages and pages of obituaries for those claimed by corona. The dead laid to rest unaccompanied, their mourning families, some of them millions, still stuck at home. But Italy may have acted too late, and perhaps not strongly enough at first. South Korea was hit around the same time, but has recorded just 75 deaths. Europe holds its breath to avoid infection, today issuing a 30-day ban on all non-essential travel to the EU. The European effort, though, is not coordinated. But America's closest ally, Britain, slower than others, only today advising people to stay home.
We need people to start working from home where they possibly can.
World Health Organization advice is more direct.
Not quarantine alone, not social distancing alone, do it all.
Back in Italy, Easter services disrupted. The Pope's solo vigil, offering up prayers on behalf of millions. And every night, tributes are laid down for their frontline heroes.
We lit up candles every night. We want to pay an invisible but strong homage to all the doctors and nurses that are constantly working to help us here.
Just incredible images from overseas, and we're going to continue to follow that and bring back in Dr. Jen Ashton, who's with us. And we were talking about this on World News Tonight, just the numbers when you compare with Italy. And take a look at these numbers at home, because in Italy, they actually have more doctors per person there than we have here in the U.S. 4 per 1,000 in Italy versus 2.6 per 1,000 here at home. Then when it comes to hospital beds, they have more hospital beds per capita than we do, 34 for every 10,000 people there. Here in the U.S., we have about 29 beds per 10,000 people. Jen, authorities have been saying that when it comes to what you're seeing in Italy and what you're seeing in France, that they're about 2 weeks ahead of the wave that we'll see here. So what does that tell you?
Well, that's exactly why you're hearing Dr. Fauci say we are behind. We have to take aggressive steps now so that down the road someone can say we've done too much. Really, time is of the essence when you're dealing with a virus like this. The other interesting thing, David, about Italy in particular, they have a different culture and society and style of living than we do. They tend to have multi-generations living together with a lot of contact, and they tend to have an older population, and I think that's why you're seeing some of the severity there.
Yeah, the cultural norms. It's just heartbreaking when you hear that they can't have funerals. They're just doing announcements in the newspapers there because they're in the throes of such a horrible, horrible moment in their nation's history. I want to bring in Dr. Vinayak Kumar because what many viewers at home don't realize is that we have a medical team that helps to support Dr. Jen on the air every single day here. And one of the things that we saw from over the weekend, when you hear that we're 2 weeks behind what we're seeing in France and Italy, is the social distancing and the lack thereof. We saw a lot of people out celebrating, of course, St. Patrick's, which I have done before, but not this weekend because of the guidelines that have been put out there. And also the beaches, for example, for spring break, they've now closed down some of those beaches. But would that have made a difference if we were able to get the word out and tell people, really, we have something coming. We're just 2 weeks behind what we're seeing in Europe.
Oh, yeah, absolutely. The key thing to keep in mind is that a lot of these young folks, they might think themselves as invulnerable, but as we talked about earlier, these guys can totally be asymptomatic. So you might be very close to a person who's asymptomatic and spread the disease amongst the youth. And more importantly, this is a public health concern. So those youth can actually infect the elderly, causing higher mortality rates.
Dr. Kumar, that's an excellent point. Think about our older generation. We have to protect them at the same time. And Jen, do we have any idea, because we've seen this question on Twitter as well, how many people one person can infect, what the data tells us so far?
We don't, but we know that the doubling time or the transmission dynamics of this is significant, and that basically every 7 days the number of cases doubles. So that is, again, why the clock is ticking, and these aggressive social distancing measures need to be put into action right now.
Which is why Dr. Fauci said we're in a race against the virus here in the U.S. All right, Jen, thanks. When we come back here tonight, the new normal in America, really dramatic, life-changing events. We've all witnessed it just over one weekend alone. We're with the wage earners now with no idea where their next paycheck will come from. We're also hearing from patients living in quarantine, those with confirmed cases and those waiting for their results, how life has changed in an instant for them. Our Live 2020 continues in a moment. There are more than 4,600 known cases of coronavirus here in the U.S. Of course, authorities believe that number could be vastly higher given the slow testing. Tonight, we're hearing from patients living through it, those with confirmed cases, those awaiting test results, and of course, those under self-quarantine because they or a family member might have been exposed to it. Our own Deborah Roberts is now in isolation with her husband, Al Roker, after a colleague of his tested positive. So Al and Deb are staying home just to be sure, not unlike so many already in this country.
My name is Rich.
Hi, my name is Lisa Merck.
James Kyle.
People all over the country are living with the COVID-19 diagnosis.
I'm from Crested Butte, Colorado.
And I am a New York City resident.
I too live in Manhattan, and after recently learning that my husband was exposed to somebody who tested positive for COVID-19, we're now self-isolating to be cautious and make sure we don't somehow contribute to the spread of the virus. For famously diagnosed basketball player Donovan Mitchell, his symptoms are currently mild.
I'm fine. Things are going well. Just in isolation, got a unique setup, but no fever, no symptoms as of right now.
But that wasn't the case for Lisa Merck.
I went to Hawaii on February 2nd with my husband. We did a 3-week travel trip.
Then life changed shortly after.
On February 19th, we were getting ready to come home, and I started getting just tiny little sniffle and didn't think anything of it. And then on February 20th, my back started hurting on the left side. My muscles started hurting. It felt like somebody was stabbing me with an ice pick.
My symptoms, I know a lot of people were asking, they came on as a dry cough, which led then to a fever and this extreme fatigue. I was doing my dishes and putting them in the dishwasher, and I became winded doing that, and that's something not normal.
I feel ill Sunday night. I had muscle pain, and the next day, Monday, after I start to cough and have fever. the shortness of breath.
Once I got the results, though, on Saturday, the doctor basically told me there's no way to treat it. They're treating the symptoms. So if you have, shortness of breath or anything like that, go to the hospital. But other than that, really just, nurse it at home with water and rest.
March 8th, I asked my husband to take me to the emergency room because I felt horrible. I felt extremely exhausted. I felt winded. Then they did the COVID-19 test. It was positive.
To be home is rough, but I've tried to think of creative ways with friends where, we FaceTime each other, we Skype, we play games online. And just remember, we got to just look out for each other. Hope this is over soon. We're going to make it through.
They are going to make it through, and we really all will as a community in this country. And we have to remember that Americans are staying home now, not just people waiting for test results, and you can only imagine anxiety for them, but for people staying home, Jen. And we want to bring in Dr. Jonathan Fader, clinical and performance psychologist, as well on this, because Jen, you and I have been saying we have to help people reduce the stress level as they're just sitting in their homes and taking care of their children and trying to keep life going as normal.
Sure, and I think we've all been feeling that, and I think that what helps with that is taking steps to prepare, because it gives you something productive to do, and it gives you a sense of having some control over a situation that really can seem out of control. And Dr. Fader, I have a question for you. With all of this social distancing that we're all doing now, it can feel very lonely and isolating. So how do you emotionally not distance yourself as you're physically distancing yourself?
Well, first, the most important thing is to control what we can control. As you were saying, we feel much better if we have something we can focus on. And so what I focus on with everybody I talk to about this, it's natural to be anxious. You need something. We all wash our hands, but what are we doing for our mentality? You have to have a hand wash for your mentality. So what I tell patients all the time is to have something you say to yourself to focus on what you control. We actually have an acronym, WIN, which stands for What's Important Now. And when you ask yourself that, you realize what's important now? What's important now is to focus on what I control. Do something to bring my breath in control. Or, we're talking about social distancing, but it doesn't have to be emotional distancing. Right. Reaching out, connecting to others can create more meaning and help you to really focus on what's important in your life and take your focus off of things you can't control that cause more anxiety.
I like that. Win. We'll remember that.
Exactly.
All right. Dr. Fader, thank you.
No, my pleasure.
Dr. Jen as well. When we come back, the new normal in just a moment. It is the new normal in America, a reordering of American life. Mothers and fathers now working from home. And late today, you heard the president saying for at least the next 15 days, avoid restaurants and bars to slow down the virus. And so Tamron Hall tonight on this American test.
So we're going to head out and check out a local diner here in the heart of New York City. Well, what we know is within 24 hours, diners like this one will be closed, only for takeout and delivery.
I've been in this neighborhood for 45 years. First time we'll close and possibly forever. A lot of these people have been with me, some for 35 years.
So in total, how many employees are you?
200.
200? Have they confided in you about, worried about rent and paying bills?
You can see fear in their eyes. You can see it. That's the worst part.
We're on our way to Garfield, New Jersey, where, like so many school districts around the country, the schools are shut down. And so many of the kids normally would get a breakfast or a lunch from school. Now, a parent or guardian has to line up to get those missed meals so that the kids can eat.
So you have a complete meal for breakfast and a complete lunch as well, complying with the USDA guidelines for nutrition.
Tell me how life is at home right now.
It's scary. The kids don't understand. Trying to explain to the kids is the biggest part. Like, this is serious right now.
This is the new normal now.
Mm-hmm. It's going to be the new normal.
We're heading about 40 minutes to another suburb to talk with a single mother, 6 children. She's a nurse. She is facing this alone with her children. I've also, just in case they don't have lights. Hi, how are you? I'm Tamron.
Nice to meet you.
Do you want me to keep my mask on, or how do you feel?
They don't matter.
Okay. All right, how are you?
I'm good.
Good. What is your number one concern today?
Me is right now with the schooling. I only have like 2 laptops. I can't have all 5 of them in 2 laptops.
Who gets to do their homework first?
Oh, I have my own laptop. She has her
You
own.
have your laptop. Do you have your laptop?
Use my mom's.
Use your
my
mom.
Everybody use mine.
And that's how everyone will be able to do their homework.
Basically.
What scares you most now?
Me, it's just, for me, is if I was with myself, I would probably just be able to handle it on my own.
The babies are just growing up. They can still get sick. And they're really important to me. I just don't want anything to happen to them.
So much fear, and you can't forget that families live paycheck to paycheck.
Absolutely. That's why we wanted to do this story. 40% of Americans have just $400 for an emergency. So when you hear the story, you need to stock up on these things, put these things in your refrigerator. Where are you going to get the money from? And that's a part of this conversation that can't be forgotten. And that's what we saw all day long today, David.
All right, now in the hands of the Senate to help.
Absolutely.
Finally tonight here, even amid the devastating scenes playing out in Italy, they sent out word, let's all come out on our balconies and send a message of thanks. In Italy, they set a time this weekend and they all came out on their balconies to applaud doctors, nurses, and all healthcare workers on the front lines. In Rome, so many families and their appreciation. There was this image from Spain, the fitness instructor who knew so many are in quarantine, teaching from a rooftop. And here in the U.S., from California tonight, the famous comedian and actor Mel Brooks, this is his son.
Hi, Dad.
With a message about looking out for our seniors.
If I get the coronavirus, I'll probably be okay. But if I give it to him, he could give it to Carl Reiner, who could give it to Dick Van Dyke. And before I know it, I've wiped out a whole generation of comedic legends. Do your part. Don't be a spreader. Right, Dad? I'm going. Love you.
I love that. A really important message for all of us. Thank you for watching here again on this Live 2020. Our coverage of the coronavirus continues later tonight on Nightline and, of course, first thing in the morning on GMA. And I'll see you all this week on World News Tonight. Dr. Jen and the entire